I can hear you.
Perfect. Okay.
Hello, everyone. Welcome to another show on behalf of ISC Entertainment Network. My name is Rohini, and today we have two really special guests with us. We have Dr. Vimal and Dr. Sandhya. They are critical care physicians from the University of Missouri, and we're so excited to have them here. We're going to be talking about a lot about COVID, what is going on with the different variants, especially in India, where we have our loved ones in India as well. So I'm really excited. Welcome, Dr. Vimal and Dr. Sandhya.
Thanks for having us on the show.
Thank you. So I'm going to start off with the first question. I mean, I'm sure we all know that we are in a global pandemic. We know what COVID is, but maybe Dr. Sandhya, I'll ask you first. How does COVID present itself? What are the symptoms that we should be looking out for?
So COVID is primarily a respiratory pathogen. So the primary symptoms that we need to look out for are respiratory symptoms. Around 30 to 40% of the patients are actually asymptomatic. They don't have any symptoms.
Mm-hmm.
But after that 30 to 40%, rest of them in around like 60 to 70%, 80% of the patients of that 60 to 70% have very mild symptoms. So they can have sore throat, just nasal discharge, or fever, fatigue, headache. It's very non-specific. You hear a lot of patients say, "Oh, I lost sense of taste or smell." So those are very non-specific symptoms. But in a pandemic, if you have any symptoms, you just should suspect that you have COVID, so that you don't spread it to others. You keep yourself. You keep others safe from yourself.
So, like COVID has been going on for a year, and I've heard like there's a lot of people that think that, hey, these are just symptoms of a common flu. These are just symptoms of a common cold. Like, what would you say? Like, I know you both work in intensive care units. What would you say to that?
It is very similar to flu because both are respiratory pathogens. So the symptoms overlap. It's very difficult to differentiate between flu and COVID symptoms. Like I said, many have very mild symptoms. So around 15% of the patients actually have severe, go on to progress to severe disease. So they can have severe shortness of breath, and they can have low oxygen levels when they check when they check oxygen levels at home. And if they get like a chest X-ray or a CT scan, more than 50% of the lung may be involved. But not all of those will require hospitalization. But many can go on to need hospitalization. Around 5% of the patients actually end up in the ICU. Those are the patients I usually see. So these are 5% of the symptomatic patients, not the overall population. So the still numbers are still low. So when I say severe, they are usually in respiratory failure. So when I use the word respiratory failure, that means they need very high amounts of oxygen, or they're on ventilator. They have some organ dysfunction like kidney dysfunction, or they have very low blood pressure. There are a lot of other symptoms going on. So these are the patients I usually see.
Okay. Thank you. Dr. Vimal, do you have anything else that you want to add to that?
Yeah, that's pretty much it. So that's why the importance of testing, because like Sandhya was saying, if you can't reliably distinguish from a symptom perspective, then that's where the RT-PCR test comes in, and therein lies the importance of testing.
Okay, can you maybe explain in like
right? So
what is the
right.
What are the
So
different testing? Mhm.
so the best test would be a reverse transcriptase PCR test. That's the test that's being done worldwide. That's the test that's being done in India, and that's
Okay.
a pretty accurate test. So
Mhm.
now the one problem is that with the new variants in India,
Yeah.
the sensitivity and specificity of this particular test has come into question. But even then, having said that, it would still be it's still reasonably accurate to go by that test.
Okay, and speaking of variants,
Hmm.
what is going on with the variant in India?
Right, right. So
What's everybody's mind?
right. So it's not just in India. So there have been multiple SARS coronavirus variants which are circulating globally. And when we're talking about variants, what it basically means is that you have a mutation in the surface spike protein, and it's the spike protein on the virus which mediates the virus attaching to a human cell. And so that it's that spike protein which is a target for both natural and vaccine induced immunity. And some of these variants have the potential to be more transmissible. Some of them cause more severe disease, and some of them can escape a natural or a vaccine induced immune response. So, of the common circulating variants, you have the B117 variant, and that is the one which was found in Kent in the UK.
Okay.
And that's been called a variant of concern. Why is it called a variant of concern? Because it's more transmissible and tends to cause more severe illness. Then you have one in South Africa, which is the B1351 variant, which is the dominant circulating strain. Then you have one in Brazil called the P1 variant, which was first identified in Japan in people who came over from Brazil. So you have that. Now the one in India you have is what they're calling the so-called double mutation. Is basically they looked at samples. So the way they find these variants is by doing something called genomic sequencing, and they have around 10 labs in India, which comes under the Indian SARS coronavirus 2 consortium on genomics, which is 10 labs which do genomics on all the latest samples. So they found this new thing where an increased fraction of samples had E484Q and L452R mutations. So it's
Okay.
because these two mutations, which might be a separate lineage developing in India, with these two mutations coming together, that's why they're calling it a double mutant. So that's the so now whether this double mutant is a variant of concern or not remains to be determined. Studies are still on. So one important thing is that the general guideline given by the WHO is that you should be doing genomic sequencing on 5% of the samples that you take. India is right now doing something like less than 1%. So that has to step up if we are to identify all variants and make any meaningful conclusions from the data that we get.
Okay, and thank you for that. Like that was a lot of really good information. Like, okay, let's just say like a person has COVID, like how can they self-isolate? Like even with these variants, like are there different kinds of processes, or do they just have to follow the same thing? Like what does self-isolation really mean?
Right. So you want to talk about that, Sandhya?
Sure. So self-isolation is when you suspect you were exposed to someone who has COVID, or you suspect that you somehow contracted and you don't know, and you started having symptoms. That's when you self-isolate. Self-isolation is a very important public health measure to prevent spread to one's own family members, and it also breaks a chain of transmissions. Once you infect your family members, and they can go on to infect many others. So it's important to break that chain. So this is why we self-isolate. So usually when, like I said before, many are asymptomatic. So they don't know, they would remain asymptomatic even if they have, but that doesn't mean they're not transmitting the virus. They're still transmitting the virus. That's exactly why if you went to a huge gathering and you don't know if people there have the virus, it's better to self-isolate yourself. Just be with your family, but not isolate to, not expose yourself to others other than the family members. Or when the rate of infections is high in the community.
Yeah.
So that's when you go for a gathering, then you have to assume that you probably contacted the virus. But if the rate of transmission is very low in the community, it's okay not to isolate. The CDC recommendations are to self-isolate ideally for 14 days. So when you do isolate for 14 days, your rate of transmission goes down to less than 1%. That's the safest.
Wow.
But can we self-isolate for 14 days? It's sometimes not practical. So that's when there are other recommendations. So there is a 7-day recommendation and there is a 10-day recommendation. So you can isolate yourself for 7 days, but the last 2 days you get RT-PCR test, and if it's negative, you just finish your 7-day isolation and go back to work or go back to whatever you're doing. And there is a 10-day isolation where you don't do the testing, but you isolate total of 10 days. And if you remain asymptomatic and you do not have any fevers, then you can just do the 10-day isolation. If you do 10-day isolation, the rate of transmission is less than 2%. If you do 7-day isolation, your rate of transmission is 4%. But if you do with RT-PCR, it might be a little bit lower.
Okay, and I just wanted to confirm that this test is available, like if like if a person calls the government, like for example, in Calgary, we call AHS and then we book a test. Is that what you're saying? Is that the same test?
Absolutely.
Yeah? Okay.
Yes. So it's the same test. In the beginning of the pandemic, it was a difficult test to get, but now it's easily available.
Okay. And I really liked what you guys said about self-isolation. Like, what would you what you just said is so important to isolate for the entire, duration of those days. But what would you tell people who think that, okay, after 2 or 3 days, like, I'm good, I'm fine, I gotta go? Or, why do I have to take this seriously? Like, I feel like there's a lot of people who think about it like that. Is there anything that you would just want to tell them?
Sure.
I mean,
Sure.
to more what you said. Yeah.
So this is pandemic, and that's why in pandemic there is these are public health measures, and self-isolation is a commitment to the community. So it's very hard sometimes to do the self-isolation because not everybody has the privilege to self-isolate. But whoever can do the isolation should, and those who cannot, we still have other public health measures like masking and everything. So we still have to follow other public health measures, but those who can self-isolate, it's better if we follow self-isolation because this is a pandemic and we all have to chip in.
I really like it's a social responsibility.
Exactly.
So Dr. Vimal, what would you say, like, how does somebody do home care?
Right. So
Oh, I think you are muted. There we go.
Is that better? Yeah.
Yes.
Yeah. So for most patients, COVID-19 can be managed at home. And that's the important thing. So if you have a fever, you could easily take an antipyretic or an analgesic like acetaminophen, which is available over the counter. You keep yourself well hydrated. It is advisable to be in close contact with your primary care physician or your healthcare provider. And then you keep monitoring yourself for clinical worsening. When I mean clinical worsening, what I mean is you need to monitor yourself if you develop either your existing shortness of breath is getting worse, or you develop a new shortness of breath that you didn't start out with, and that should prompt clinical evaluation. As Sandhya said, you should separate yourself from other household members, including pets. You should frequently hand wash. You should disinfect all commonly touched surfaces, and it's a good idea probably to get an incentive spirometer, which is basically a handheld device which encourages you to take deep breaths by giving you a visual incentive. So it's like there are 3 balls in it, and it's very easily available, very cheap. And when you do that, the thing with this virus is this virus tends to deplete surfactant, and surfactant is what keeps the air sacs in your lung open. So once those get depleted, there'll be a tendency for these air sacs in the lung to collapse, and that's how you get a pneumonia. Because when you have an infection in the lung, it tends to cause a little bit of chest pain on deep breathing. So there's a tendency for people to breathe shallow, and you don't inflate your lungs, and then you get more collapse, more pneumonia, and it's like a vicious cycle. So one of the ways to if you do get infected is to use an incentive spirometer, so that helps keeps your lungs open, so as to say. It's there's also been some studies about lying down prone on your belly, simply because there are lots of physiological advantages with regard to opening up the areas of the lung which are towards your backside, and it results in improved oxygenation. Now, this is we do that in the hospital for almost all hospitalized patients. Studies for doing it at home are not very conclusive, but I don't see the harm in doing that.
So when do you know that if you need to go to the hospital?
Right. So as I said, so the other important thing to have at home is a device called a pulse oximeter. So the pulse oximeter is, again, easily available, and it shows your oxygen saturation. So as long as so normally you should have a 98, 99 oxygen saturation, even 100. But the concern happens when your oxygen saturation goes less than 92%. And once it goes less than 92%, you do need oxygen, and hence you do need hospitalization. So that would be the thing. So as I said, if you're getting more short of breath, you're struggling to breathe, or your oxygen saturation objectively on the pulse oximeter goes less than 92, that is a definite time where you should not be managing yourself at home anymore, and you should be going to the hospital.
Thank you so much for explaining that. I remember my grandma, she had the device with the balls, like what you were saying. But like this was back in 2019, right before COVID hit. But I think we should all take precautionary measures. Before we talk about that, let's just take a quick break, and we will come back and talk about how we can prevent.
Sure.
Thanks.
Do you know the area of your house decides the school your child will go to? Do you know how to check the quality of a home? Will banks give you a mortgage? For all the answers, sign up with the Home Buyer Awareness Program and meet a school area specialist, a home quality inspector, and a financial advisor. Don't wait. Sign up with the Home Buyer Awareness Program in the link below, or contact Raj Popla at RE/MAX Central today.
Welcome. Thank you. We're back. I'm just really liking how, both Dr. Sandhya and Dr. Vimal, you're explaining everything. It really makes a lot more sense. What would you say are some preventative measures, other than what we did discuss, but other than
so the preventative measures. So these are public health measures. CDC has put out this recommendation from the beginning. So the primary preventative measure, because like I said, COVID-19 is primarily a respiratory disease. So the first preventive measure would be a mask. Even a simple cloth mask will be useful more useful than no mask at all. So a multi-layer cloth mask is comfortable and can be easily used. And there are other masks which are non-cloth type, which can also be used. Double mask is better than a single mask. If the transmission rate is very high, you can put a face shield with a mask. So N95 is not recommended for public because it's um, you want to preserve N95s for the hospitals and healthcare personnel where they see more severe cases. So a regular mask, a homemade mask, any mask is should be used. The second measure is physical distance. A 6 feet distance is the best if we can. If not, a 3 feet distance is okay. If everybody is masked, a 3 feet distance is probably okay. But in general, a 6 feet distance is what's recommended. Then frequent hand washing. You touch surfaces, there may be somebody sneezed or coughed, there may be particles sitting on a surface. So if you touch surfaces, just wash your hands, or you can use hand sanitizer. And when you're outside and you are in a party or somewhere and you're touching the surfaces, make sure you don't touch your face or eyes or nose. Just make it a habit not to touch your face when you are outside. Again, if it's a place where, like if it's your office or something, and if it's like a frequent surface where people are frequently touching, have someone clean it every so often, like sanitize that place. So these are like very simple public health measure that would prevent spread of the virus.
There's been lots of like messages like circulating over WhatsApp. Obviously, have your ginger and nimbu and do your breathing exercises and stuff like that. But does that scientifically, does that help? I'm sure it does, but
there is no data to suggest that any of those measures help. But those are harmless if you want to do it, but don't overdo it. But I don't think there are any studies to suggest those would help. Try to stay fit. Try to build your immunity in general. So those two, having good nutrition, those things help more than specifically like ginger or something else. Do you have anything to add?
Dr. Vimal, do you have anything to add? Yeah.
Yeah, I think she covered most of the stuff. So
okay, well, I know. Okay, so this is again. I know we all, these are the public health measures. We all know this. Now, I just kind of want to take it to human beings in general. I just feel like this has been going on for so long. People are getting tired. People are getting tired of it. Sometimes you don't really. You kind of feel like, okay, do we really need to mask up, or do we really need to social distance? Why is it still happening? We also have family back in India. I guess, could you maybe just talk about what, just the severity of what's happening in India? And I think they don't, people living there don't really have the privilege to, social distance.
Yes, you're absolutely right. So it's easy to say social distance, but if you have a very high density of population like we do have in India, then you may have places where you have 10 family members in a one-room house, and then social distancing is much easier said than done. And I totally agree with you. And that's why some of these measures, while they work in advanced countries or the West, it is a lot more difficult in the developing world. However, having said that, Indians in general, in my opinion, having worked there, having grown up there, are very smart, and they're also very keen to try and implement public health measures as long as we educate them. So I think in India right now, I mean, of course, I think India is fighting pretty hard right now, but we need to fight even harder. So I think we were very good during the first wave of the pandemic last year, where everybody was very conscientious. They followed the guidelines to a hilt, and India, in fact, was a success story in the first round of the pandemic because I think a lockdown was put at the right time, and most importantly, people were following public health guidelines. In between, once the cases went away, I guess it's natural to it's difficult to stay cooped up at home for months on edge, and I think people took it a bit easy and then started going out, coincided with a bunch of festivals, and people started doing social gatherings, and then we're seeing what we are seeing now. So right now, what's important for us is to mask up, avoid crowds, and we're the vaccination. The difference this time in this wave of the pandemic is that we have a tool now to fight against it, which is the vaccine, which we didn't have the first time around. So our best bet would be to vaccinate something of somewhere between 5 and 7 million a day. And currently, India is doing something like 2.5 million a day, which is itself a very tough to do. So kudos to India for being able to vaccinate 2.5 million per day. However, at the pace that the way the infections are spreading, we have to do even more, something like 5 to 7 million a day. And as I spoke about genomic sequencing, we have to make that roughly 5%, and we have to equitably distribute resources. I know that most people in North America, we contributed to some of the NGOs to send oxygen concentrators to India. We need to ensure that these supplies get equitably distributed. And then I feel that if all this is done, what I just enumerated, then we have a shot of seeing the case numbers go down after a month or so, and at least prevent a third wave. Like some of the measures that we take right now might prevent a third wave of the disease. That's what I feel.
And you talked about vaccines, but aren't the vaccines not working against this new variant in India?
So that's a myth, and to be honest, so the data which was released both by government authorities show that your chances of developing severe disease are actually very slim if you've got both doses of the vaccine. If you've taken 2 doses of vaccine, and so the one important thing is that the vaccine is protective only roughly about 2 weeks after the second dose. So let's say I get my shot today of the second dose, I still have to take precautions with masking and all the public health measures that we discussed ad nauseum before I can consider myself protected. Even after that, in the pandemic, it would be advisable to still mask and avoid crowded places. But once you've got both shots for 2 weeks, regardless of the variants, the current data suggests that your chances of getting severe disease are extremely slim if you've taken both the doses of the vaccine. So I'd still say the vaccines are working. They are working against even the variants, and that's your best bet. So I feel that it's important to tell the public that the vaccines do work even against the variants. And if you look at the CDC data in the US, they actually came out with data which showed that only 0.003% of people who took the vaccine, in fact, it's 0.0003%. So that's so slim. Who got breakthrough of people who took the vaccine who got breakthrough infection, which was severe enough to get hospitalized. You may get COVID, but it's going to be a mild disease, which will go off like any ordinary flu. And that's a staggering success rate for the vaccine, if you ask me. So it's even more successful than what we had hoped for when the initial trials for the vaccines came out.
So what would you recommend? Like, okay, I think in North America we have Pfizer, Moderna, AstraZeneca, and can you just, what are the differences? How do you decide what vaccine to get?
Right. So Pfizer and Moderna are based on a new technology, and they're called mRNA vaccines. Okay. The Johnson & Johnson is an adenovirus vector vaccine. It works by a slightly different principle. And then the vaccines which are available in India, like Covishield and Covaxin, are based on adenoviral vector principles. So the mechanism is not important. The point is that you should take whatever vaccine is available to you right now. That would be the best strategy.
I was so sorry, what if people are so worried about the mechanism of it?
So the mechanism, regardless of mechanism, all of them help your immune system to develop antibodies against the spike protein of the virus. So in that sense, they all have a common mechanism. Now, how do you make the immune system target the spike protein is where the mechanism differs. And the trials for the two mRNA vaccines showed that they were 95% successful, while the trials for the AstraZeneca vaccine was something to the tune of 65 to 70%. However, the actual data which has come out now shows that the effectiveness may be actually higher than that. The best vaccine is the one available to you, and I wouldn't try to choose. If I got any of the vaccines, if it's available, I'd just take it. That's what I would do.
Okay, vaccine up. Let's vaccine up. I know in Calgary we are going to get our third lockdown tomorrow. But there's a lot of feelings of distrust with the government, or just people are just getting tired, or like some people are on the fence of getting vaccines and stuff. So I hope they're watching the show, and I hope I hope people can share information, because I think there's a lot of information coming from social media and everything. Like, maybe would you recommend maybe some sources where people can actually just research and find legit studies?
Sure. So the Center for Disease Control site, which is by the CDC Atlanta, it's up to date. Anything new that comes in usually comes onto the site, and they write it in a language which is something very easy for a regular person without a medical background to understand. You don't necessarily have to read the trial data, which your physician might read. But for the general public, the CDC website is a great resource.
CDC, thank you so much for that. Okay, well, I've heard of something, and I want to clear this up too. I heard that the new variant in India, you don't get, if you're really, really feeling the symptoms and you do not get oxygen within 48 hours, it can kill you in 3 days.
Okay, so as I said, for a huge majority of the people, even in India, they're not going to get sick enough to even warrant hospitalization. However, as I said, you have to monitor your oxygen saturation at home. It's for most people, the incubation of the period for the virus, incubation period is the time between you meeting a person who's sick, coming in contact with a person who's sick, and then getting the symptoms of the disease yourself. That is, it's up to 14 days, but most people start getting symptoms within 4 to 5 days. And that's when you should get your pulse oximeter. I would order it beforehand, simply because we're in the pandemic, and then monitor yourself, monitor your symptoms, get yourself tested. And if you test positive, then do all the self-isolation measures that Sandhya spoke about, and then use your pulse oximeter and monitor your oxygen saturation. If your oxygen saturation is above 94, you have nothing to worry about. Something in the 92 to 94 range, I'd start moving myself to a hospital.
Okay.
Okay.
Thank you about that. Yeah. Well, I mean, this is so much to kind of process. Dr. Sandhya, do you want to elaborate to the vaccines or?
Yeah, I just want to add a few things for Indians especially.
Yes.
So I know there's a lot of thing about holding some medications to prevent coronavirus, like hydroxychloroquine or ivermectin. They are not shown to prevent the virus or the disease at all. Maybe there are some monoclonal antibodies now that have shown some benefit in preventing the disease altogether, but those studies are not big studies and they're still being studied. And also, there has been this online request for plasma and remdesivir. Please don't bother about those. The benefits, the plasma doesn't help. Remdesivir has some benefit, but it's not end of the world. So I think oxygen is the main state of treatment for COVID-19 pneumonia and respiratory failure. So that's more important than any drugs. Do you want to add anything, Vimal?
Yeah. So when you go to the hospital, and right now, I know even getting to the hospital is a problem in India. But ultimately, they're going to give you oxygen, and they will start with low flow oxygen. Uh,
Mm-hmm.
so where they just put a nasal cannula or a face mask and they give you oxygen, and that's what you start with. And if disease gets worse, they move to other devices like a high flow nasal cannula or non-invasive ventilation, or worst case scenario, you might need to be intubated and put on a ventilator. Uh, in terms of specific therapies, the most important therapy is a mortality benefit was seen with steroids. So the specific steroid they used in the trial was dexamethasone. And like
Mm-hmm.
Sandhya said, remdesivir has some data with hastening the time to recovery, but it hasn't been clearly demonstrated to have any kind of mortality benefit. So that's why one shouldn't be, going crazy trying to procure remdesivir, which is what is happening in India.
Oh.
Dexamethasone is the advantage with the good thing about dexamethasone is it's cheap. It's easily
Mm-hmm.
available. Almost all the
Mm-hmm.
hospitals have it, and frankly, that's the only thing apart from oxygen which helps the patient. Remdesivir, as I said, if you have it in certain situations, you can give it, but it's not the end of the world. There's
Mm-hmm.
another medication called tocilizumab, which has some effect in combination with steroids. Uh, uh, if your oxygen requirement gets really worse as soon as you go into an ICU, and so we tend to prioritize tocilizumab for the severely ill patients on higher levels of oxygen support who also have significantly elevated inflammatory markers like the C-reactive protein, more than 75 or so.
Mm-hmm.
Okay, the thing I want to stress about is the
Mm-hmm.
steroids are like she said, plasma, no benefit. So there's no point running around because you keep seeing these WhatsApp messages about donating plasma, and people are running around to get some plasma in the hope that it's going to save their kith and kin. But honestly, plasma doesn't have any effect. We did use it in round one, in
Mm-hmm.
the first wave of the pandemic, but so we didn't find a lot of benefit. And subsequently, the trials came out, and so you could use it if it's in the context of a clinical trial, but otherwise, I don't see the benefit of
Yes.
using plasma. Right. So it's steroids, and oxygen, steroids and oxygen.
Sorry,
And
oxygen.
that's once you go to the hospital. You do not give the steroid if your oxygen saturation is good and you're sitting at home.
Mm-hmm.
The steroids could be counterproductive in that setting. I'm talking about steroids and steroids for a patient whose oxygen saturation is less than 92. He goes to the hospital. He gets put on oxygen. That's when steroids are
Mm-hmm.
started.
Well, I mean, well, thank you for, really breaking it down and explaining everything. I guess my last question was, what would you kind of say to the people who are living, abroad, like away in India, and we have her family back in India? I know there's just so much going on in the news. There's a lot of feelings, sentiments, worry, a lot of news. So I
Right.
found that this show was so informational. Like, both of you are just so specialized pulmonologists. It's so great to talk to you. But yeah, you want to share?
I think it's very nice of you to be. I think messaging and distribution of information is key, and so what you're doing is actually really useful from a public health perspective, and we're happy to just be able to contribute, and we're thankful that you invited us. To the people in India, to abroad who are watching, who have folks in India and who are really worried
Mhm.
about it, I'd say try to stay positive. Keep open lines of communication. We've been, I mean, if you know physicians, then there are lots of these telehealth stuff that we're doing to be able to, like I myself try to do teleconsults for patients so that who are being managed at home and not able to reach the hospital. So I think it
Mhm.
just gives them, although you may not be able to do a lot in terms of physically doing something, but just
Yeah.
being able to talk to a physician over here, um, and that can allay a lot of anxiety. And it would also keep a lot of people out of the hospitals who don't necessarily need to go to hospitals, because then if you put a patient in a hospital who doesn't actually need to be in the hospital, then you're occupying a bed and
Yeah.
depriving somebody who's much more sick. And so that's the advantage of the telehealth that people abroad can do for their loved ones back at home.
Thank you. Thank you, Dr. Vimal and Dr. Sandhya. And I just want to say, like, to everybody, the Indian Society of Calgary is partnering up with Red Cross. So if anybody does want to donate to the Red Cross, they surely can. We have the link in our in our video here, and you can also check it out after. This show is recorded. So I just wanted to say that as well. But thank you, Dr. Vimal. Thank you, Dr. Sandhya, for
Thank
taking the
you.
time.
Thank you
to
for
talk
having us.
about it.
Thanks for having us.
Thank you. All right. Take care. Be safe. Get vaccinated. Educate yourself. Go to that website. No.
CDC.
Okay.
CDC.gov.
Thank you so much. All right. Thanks, Dr. Vimal. Thanks, Dr. Sandhya. Take care.